Interior's database of who is present in Saudi. So I have a number on my passport that is my visitor ID. Folks who come here have an Iqama number if they come here to work. And citizens have their national identifier. This is all stored in the Ministry of Interior. We're connecting to them using standards to be able to turn that into now a national patient identifier. And everybody who connects through the cloud will first determine what the patient's national patient identifier is, and then use that in their interactions with the cloud. Similarly, we have identifiers for all the providers and all of the healthcare organizations. Every hospital that is in the country has an identifier that's assigned to it by one or the other department in the Ministry of Health. And so we have connections to those databases as well, plus all of the licensed providers and nurses. And I believe, I see pictures, people taking pictures. I know these slides will be made available. And if not, I will happily give out my business card, and you can ask me for copies of them as well. And anything you see here, feel free to tweet. Right? Put it on Twitter. So the point of service system, that could be the HIS, the RIS, the LIST, the PACS, all of these different information systems connecting through the cloud to the health services bus to get access to information. And there will actually also in that cloud be the web-based portal, the PHC system that's accessed on the web by the Primary Health Center, PHC. Primary Health Center for those that don't have an EHR or connected to a hospital and have access to the hospital's HIS. We'll be able to do that through the web portal, and that will also access some of those same services to support things like e-prescribing. Now, that's a lot of things to connect together, right? If you're going to connect all of this stuff together, what do you need to do? Well, you better figure out how those connections work, all right? I come to Saudi and I plug my computer in and it works. Why? Because we have standards. Now here I have a little bit of a challenge because I have 3 different standards to choose from. We'll talk about that in a little bit. But that just works. Light bulbs are the same way. Right? If you have the incandescent light bulb, that actually started from an original GE, General Electric base, that was given to a number of experts and say, we have 10 different bases and everybody is making light bulbs in different ways. And there's no real value in us in designing a new base. Oh yeah, we can lock in customers for designing a new base, but nobody's really gaining any advantage from that because we have 10 different bases and people aren't able to move up to the next best thing because we have all of this variation. If your cell phone's all charged off the same connector, wouldn't that be so much easier? Wouldn't we have fewer things made out of plastic with a bunch of precious metals inside being thrown into the dumpster because somebody upgraded their phone and they can't use their old charger? Right? So now we have mini USB, micro USB in Europe that's actually coming now worldwide to many phones, and eventually maybe someday the biggest proprietary maker of cell phones will have to change its 30-pin connector to the standards that the rest of the world's using, or maybe we'll have to change to the standard that they're using. So in order to be able to support this, we need to use standards, and we've already been developing these standards in the Ministry of Health. This is being done through the Strategy and Change Management Office, because what's coming is change. What's coming is huge change. So we have these 6 different specifications. The first one, KSA-wide patient identity query. That's the query that's going up to the Ministry of Interior's database, and we're actually using healthcare standards to do that exchange and connect that together so that you can get from there a patient's health identifier and have a common, unique identifier. Be thankful that you're able to do this here. We have this problem in the U.S. that by law, the U.S. government is not allowed to talk about or spend any money on development of a national patient identifier. So if I needed to go to Portland and get care at Oregon Health and Science University, I'd have one patient identifier. If I go to my healthcare provider in Randolph, south of Boston in Massachusetts, I'd have another health identifier. If I went to the hospital, I'd have another one. If I went to the imaging center, I'd have yet another one. This is a huge, huge, huge challenge for research, for patient safety, for so many other things. You won't have that issue here. Similarly, we need to find not just patients, but also healthcare providers and organizations. I have a case where patients who are going from one city to another to travel might need to find a doctor in another city, and they're going to see their primary healthcare provider. And they say, well, I know I'm going to be in Jeddah next month when I go to the HIMSS Jeddah event there. What doctor would you recommend? And they can go look that up. Lab results, right? We've got two standards around how we can not only show the results in a standardized fashion. I think some of you learned about LOINC, and some of you taught about LOINC last term. As a standard for dealing with laboratory results, that's actually now been identified as being the standard that will be used in the kingdom. Laboratory orders, and then how you're going to connect up to that PACS in the cloud and share information. We are working presently on 9 more. We're dealing with standards around, and actually it's more like 10 more, I think. Because we have these 6, 2, 3, 10 more, because we just added the IHR summary. This set of use cases, so 6 around clinical notes and summaries. What's the documentation and how is it communicated to capture patients' problems, meds, allergies, immunization, family history, social history? You could probably run the list better than I could. How do we start turning prescribing from a paper process into a digital process? Immunizations. Hessen. We heard about Hessen several times in Russ's talk. So the eHealth exchange is going to be connected to Hessen. It's actually going to be getting information from the primary health centers where the immunizations are given. The doctor's going to report that in the encounter summary. And that's going to go up to SEHE, and SEHE is going to take care of the submission to Hessen. I don't have to report the immunization separately now. I don't even have to go to a form and fill out a form to report it. That information is going to go there. It's going to be captured. They're going to know, oh, there was an immunization that was done. Right? Now, is this going to happen tomorrow? No. Is this going to happen next year? Maybe. Is it going to happen 3 years from now? More than likely. Okay. So these are the kinds of things that are going on. The standards are being developed now, and we're looking out many years into the future as we develop these information systems. There are actually 2 e-referral systems used. There's one that's used in Riyadh, and there's one that's used in the rest of the kingdom. 2 different projects going on. We're actually looking at standardizing the exchange of the information. We're working with both of the vendors to also get them connected into this and help identify and set the standards for e-referral. So this is work that's going on right now. Anybody interested in participating in that work? Anybody interested in finding out more about what's going on in that work? You will all have opportunities. I have a list of workshop dates that are coming up at the end of the presentation that I am inviting you to. I've been given permission by the ministry to invite you to. They will be happening here in Riyadh. There's also a pre-conference workshop happening in Jeddah the day before HIMSS or the day after HIMSS. We're still working out all of the dates. We will have them soon, inshallah. Okay. So we'll be talking more about these. Now, the problem with standards is there are so many to choose from. Look at all of these standards organizations. This is standards that are used in healthcare. HL7, IHE, ASTM, X12,